IVM.
Hello and welcome to the Habit Coach podcast. I am Ashdin, doctor, your habit coach, and today we have a very special guest with us. She's a dear friend of mine and I've been wanting to have her on our podcast for ages. Okay, she is a pain specialist. She's a doctor designed, or well, not designed, but studied in pain management and pain about the neck, the head, the jaw. And it's absolutely fascinating talking to her because, very often when we start talking about, pains, headaches, migraines, we get so stuck up in saying that it's always been happening to me. I'm always being plagued by it, etc. But, today, in today's podcast, I want you to understand that there are options. You can get rid of it. You can learn how not to get it. And there are so many different aspects that we're going to be covering today. And every time we catch up, we have a fantastic chat. So that's what I want to bring to us and the Habit Coach podcast and our listeners. So without further ado, let me welcome Dr. Raashi Khatri Punjabi to our Habit Coach podcast. Raashi, welcome.
Thank you so much, Ashdin. I'm so excited to be a part of your podcast. I have been following you even before you became the habit coach. And I'm so inspired to be a part of someone who can contribute a little bit to all the people who listen to you. So I'm deeply grateful to be here, and I can't wait to talk about headaches, pain management, and ways to look after them without having to pop too many painkillers. So super excited.
No, absolutely, right? Like we need to start getting away from these things, learning about our bodies, understanding it so that we can actually start taking care of our health in that sense. And there are so many different aspects to this. My favorite question to Dr. Raashi starts off by saying, Dr. Raashi, what is pain?
So, Ashdin, there's not even one person on planet Earth who has never experienced pain in their life. And I mean physical pain as well as emotional pain. But pain is your body telling you that you are alive. Pain is your body being kind to you to let you know that, hey, I exist, because every time I feel slightly uncomfortable or every time you do something that doesn't help me or allow me to be my most wholesome self, I'm going to give you this little bit of discomfort to let you know that you need to draw your attention elsewhere. Now, none of us enjoy pain. There's not one person on planet Earth who will be like, yay, pain. But pain is actually our body's kindness. Pain is our body's protection. Pain is our body's way of reaching out to us and letting you know that, hey, stop, there is something that is not working optimally. Let me give you an example. If you and I are sitting right now in our respective chairs very comfortably, but if we fall off that chair and we bump our hand against the floor and possibly break it, till we won't experience pain, we won't recognize the degree of damage that has occurred in our hand. If it's just pain that lasted for a few seconds, we'll be like, just a bruise. But if it's excruciating pain, that pain actually communicates to let you know that you may have possibly damaged your bone inside or pulled a muscle. So, hey, the person living inside this body, you need to start taking action immediately to allow for that pain to get better by you repairing whatever it is that I'm trying to communicate to you. Correct?
Superb.
Unfortunately, Ashdin, for any pain that exists in our head, face, neck region, and even because we are creatures of convenience, what we land up doing when we get a pain is that we forget to listen to the wisdom of our body, and we choose to pretty much subdue the symptom of the pain that is coming in by popping in unnecessary amount of painkillers or taking medication that pretty much numbs out the sensation of pain, but doesn't really do anything to repair the root of the pain or the source of the problem that your body was trying to tell you. So this is me, an allopath, someone who trained in medicine, telling you that medicine is always not the right answer, especially when you're looking after long-standing pain. So yeah.
Wow. Superb. Thank you for taking that step. And, Raashi, I want to understand how as humans, our ability to communicate with ourselves, how did that suddenly disappear or break down? Because pain, like you said, is communication, right? Where did we stop listening or where did we stop understanding this?
So, Ashdin, this question, it's a great question, by the way. It has two answers to it, or two rather subheadings that we need to delve into. One of them is that when we are sitting, we tend to identify ourselves as only the physical aspect of our being. Now, all of us have a physical, tangible body. We can weigh it. I'm 50 kgs, I'm so and so height, I wear size 8 clothes, my shoe size is XYZ. So the tangible physical aspect of us makes our physical body. But what allows us to emote, feel, have happy thoughts or sad thoughts, which are also equally valid, is our emotional aspect or our emotional body. We also have something called our buddhi or our intelligence body, right? Now, I may want to go from Delhi to Bombay. I may have feelings about, oh, it's a long distance, but logically, I know that I have to go from Delhi to Bombay. It's going to take me so many hours. So, non-emotional thoughts or logic that we store in our brain makes up our intelligent quotient or our mental body. And of course, there is a part of us that makes us alive, which you in religion they may call it spiritual body. Some people may choose to call it the universal consciousness. Basically, it's your soul that allows you to be alive. Now, 4 of these aspects come together to make you you. Correct? Correct. Modern allopathy has advanced so much that we have a toenail specialist. We have hair cuticle specialist, hair keratin specialist. We have a heart valve specialist. So allopathy has advanced beautifully to give people that are seeking it to get the best possible medical outcomes. But what a lay person tends to do is a lay person tends to think of themselves then as a bag of organs. So we forget that our stomach is very much communicating with our head. We forget that the way we breathe actually affects even the blood flow in our toenail. We forget that the source of your headache may be very, very far away, somewhere in your groin, rather than somewhere inside your brain. So rather than getting worried when you have a headache and you think, oh my God, I am getting a brain tumor, or thinking of the worst when you can't figure out what's going on, what we need to do is start figuring out what is my body communicating to me as a whole from the physical, mental, emotional, and possibly spiritual or energetic aspects as well. Because only when you recognize yourself as that whole being will you be able to treat yourself to a wholesome awareness and be completely healthy, rather than looking after yourself as bits and pieces of a machine. Because that's not who we are. That's not who we were meant to be in any case. So that's one.
This is why I love talking to you, because you've just completely simplified this. You're saying that we just think of it as headache, correct? We just think of it as knee ache. But the idea is that we're not worrying about what is happening at the rest of the body. Who says that our knee ends here? Just because somebody at some point of time while dissecting a bicep said, I'll cut it here and cut it here, and this will be called the bicep. We don't know how far technically the body feels it continues for. Absolutely. And I know this might sound like, like a far out woo-woo thing for some people. But what is important to understand is right now we're talking about pain. And if pain is communication, and if we've forgotten the language of what the pain is trying to say or what our body is trying to say to us, pain can come from us in our physical manifestation, can come in our emotional body, they come in our spiritual body, and come in all these things. We have to learn how to pick these things up.
I'm so glad you're talking about this. So guys, I am a American board certified allopathic doctor. But it took me years of seeing patients with pain to actually go back to what is the WHO or the American Pain Society or the American Society of Pain definition of pain, which is that pain is an unpleasant emotional experience which either lets you know of a current injury to the body or a probable injury to the body and can also be complex in nature when it becomes chronic. So simplifying that, if I had to break it down, they have never, even the medical boards have never defined it as X and Y. They say it is the experience of what the person who is going through pain goes through. So pain is always, just because it can't be seen, we tend to ignore it, or we tend to shove it into some part of our brain, saying that I'll deal with this pain when I have to. I'll deal with this headache when I have to. Right now, let's quickly pop in that pill and get to whatever needs to be done. But your body, when it doesn't get what it's seeking in terms of becoming whole again, goes through an experience of storing that pain and amplifying it every time you don't respond to it. So eventually it becomes into a complex chronic condition. So your experience of pain, which could have been looked after in an easier, simpler way, becomes into a painful lifestyle. How many people we hear of, Ashdin, who will tell you that, oh, I don't want to work out because I have a bad back, I have a bad knee, I have constant migraines, I have lived my life with this shoulder pain. You are choosing to live a life of pain. You are choosing this background dullness that takes away from your quality of experiences that you can have in life, because you're choosing not to be mindful about what your body as a whole is talking to you. And it is so important to be able to understand your body, to be able to live in it.
Absolutely. Right. And it's so interesting that you said that it's a choice that you're making. Correct? Because we just this morning recorded an episode with a gentleman who talked about you always have two choices. Everything can be distilled down into two choices. And even this is a choice. Do you choose to live in pain or not? And now I know lots of people will say that, what a stupid question. Who will want to choose to live in pain? But I know that you would have met people who don't want to either heal, and that's another topic altogether, but who just don't know what to do. So they're choosing to live in that pain. They're not accepting something else that could possibly help them out.
So, Ashdin, I think, what happens is not so much as a choice of not taking the right help if it's available. But I think right now it is also a lot about not having the awareness that help is available as far as pain is concerned. It is really unfortunate, but pain management is not taught in India as an MD specialization yet. It is taught abroad. And a lot of us Indians who go there to study, a majority of us go there to study, a handful of us come back. So it is not prevalently practiced in India yet as a standalone MD specialty. There are lots of excellent, well-experienced doctors who have recognized the need to look after pain. So they have been educating themselves, doing small courses, and using the experience of lifetime of seeing patients to help their patients better. But there is very little awareness that the general public has about pain and the repercussions it can have on your body if you don't address it. Which is why most of the patients that I see have long-standing pain. They'll tell me headache histories of 20 years. I'll have, I'll have patients who...
And for so many years, they didn't do anything in terms of, I couldn't go to weddings. I couldn't spend time with my family. I couldn't be the person that I wanted to be because of this pain.
Couldn't travel. I couldn't sit for my sister's wedding because it was outdoors. And when I sit outdoors, the sun gives me a headache. Not being able to enjoy your child's first birthday, not being able to be available as a daughter, as a son, because on that day, it was a bad day for you. So pain is something which cannot be seen by your family, but it is something that you experience yourself. A lot of people who have had long-standing pain, they feel, what should I tell my family again and again where the pain is? Maybe I sound irritating to them. So let me just not tell them about it. Let me just pop in those 2-3 pain killers quickly. Let me do what I need to. I'll deal with it later. And then that later never happens. And that awareness that help is there is hopefully something that we'll be able to do with the podcast. Tell people that chronic pain, headaches, migraines, neck pain, back pain, pains that you may have had for 30, 40, 50 years of your life, fibromyalgia, these are curable. These, once you are able to diagnose what your body is communicating to you in totality, not in parts, will give you the clues of how to actually reverse it and get to a point where you feel healthy, where you feel whole, where you're not able to shy away from living a fuller life, where you're able to lead the quality of life that your body deserves you to have, as long as you can figure it out. Yeah.
No, your body deserves it. You deserve it, right? Your body can give this to you, and you can learn to do that. And there are two important points that I wanted to make from this. One is that, like, pain is like a dog, like that you've kept in the other room, right? It'll first start with scratching. If you're still not listening to it, it'll start with more violent scratching. Then it'll start with barking, and you'll just see it escalating because it's trying to communicate to you, and you're hushing it down.
Yeah,
that's one aspect of pain, like you were saying. The other aspect of pain is that because, like in the definition, it's a subjective emotion, a subjective feeling, a subjective experience, everybody else around you cannot see it. So in fact, I've had so many clients who have come to me with pain, saying that I don't know who else to go to because I've gone to doctors, my family doesn't believe me anymore. So I'm guessing there's something wrong with my habits. Let me try and see how we can do it.
Yeah.
And by fixing aspects of their life, we managed to at least subdue it. But the point is that they came because people stopped believing them.
Yeah.
And I think that is a big, big tragedy. And, if you have a family member who is in pain and you just seem saying that, they've been having pain for the last 20 years, who has pain for the last 20 years, trust me, you don't know what they're possibly going through. So take it seriously. And now we know that there is an option ahead. And that's something that we can do about it.
So there are few and very, very good pain management specialists in India. Please reach out to them if you have any pain that you want to get diagnosed. I always say that I'm a very, very qualified traffic policeman or a detective that will help you figure out what is the root cause of your pain. And then I leave the option up to you what you need to do for it. Ashdin, when you spoke about validation of pain, what a beautiful thing to say. Because a lot of times, and very well-meaning people who want to look after their pain will go from A doctor to B doctor to C doctor to D doctor who are possibly not trained to catch it. Exactly like if someone comes to me, say with a gynecological problem, I'm not trained to catch it, or I may not be trained to help them with it. So I wouldn't be able to take on the ownership or the onus of guiding them well enough as a specialist would. But what happens a lot of times is that, shockingly, a lot of my referrals come to me from psychiatrists or psychologists or psychotherapists because when a person hasn't got a diagnosis, say for 10 years, 12 years, but the patient or the person is going back home and for them their pain is very real because, of course, it's there in their body. They're experiencing it. It's not allowing them to lead a full life. Eventually, somebody will tell them, you have stress. No, that's why this has happened to you. Your stress will go away. All this pain will vanish. And these people find themselves because they're ready to do anything to allow themselves to get better. So, of course, they'll also go through that full angst of, is it cancer? Is it a tumor? So they'll go through lots and lots of MRIs, CT scans, and they'll every time be told that there's nothing wrong in your MRI, you're imagining this pain. So eventually they'll find themselves in a counselor or a psychiatrist's office. And there are psychiatrists who very sensibly evaluate them and realize there is nothing really wrong with them. They have stress, which is as much as stress as anybody would have. But for them, they actually have pain that has not been addressed. So a lot of times there are psychiatrists who are calling me up and saying that I believe this patient does have some pain. And then when we do land up taking their pain away and looking after their lifestyle, or at least pinpointing out to them that, the awareness that your XYZ lifestyle, your XYZ habit, your XYZ choices in life are not allowing your pain to get better 100%. They're contributing to your pain. The moment we start looking after this wholesomely, suddenly the patient is happier. There's no stress. Because a lot of times People get stressed out when they are ignorant about what's happening in their body and they can't find those answers. But stress per se will not start pain. May I throw out an example to you over here?
Please.
So, Ashdin, what's your favorite holiday destination in the world? Where would you rather be right now?
In the mountains.
Okay, so if you were sitting in Kasoli, imagine you're sitting in Kasoli, the beautiful gushing lake is next to you, the river is next to you. You have this hot piping bowl of Maggie in your hand and a coffee or whatever is your choice of hot beverage in the other. And you're looking at the mountains, you're looking at the river, and suddenly you fall down because you were so mesmerized by the beauty of it all. And your elbow hits the edge of the rock and you actually get a fracture. Okay. Now, the pain that you will experience in Kasoli, in those beautiful surroundings, would be an 8 on 10. Correct? Now, imagine you're right now at home. It's the lockdown. It's the 8th month of the lockdown. You have zero domestic help. You're doing jhadu, pota, bathroom, everything you're doing. Your child has an exam. Your mom is not well. 20 things are going on. The stock market is crashing, whatever. And you fall down and you break your hand. The amount of pain that you will feel with your hand broken under stressful circumstances will also be a 8 on 10. Because your body is going to produce a 8 on 10 pain to let you know your hand is broken. Now, whether you feel peaceful about that hand broken or you feel agitated about that hand broken, the hand breaking will come from your perception of the pain. What you feel about your pain under those current circumstances. There could be a possibility that in Kasoli, you're like, oh crap, in the middle of my trek, I have broken my hand. Where do I go? So you may be very stressed over there. And maybe at home, you might be that, oh, anyway, I'm in the lockdown, I can't get out. And you may be very peaceful about it. So your body's pain would fluctuate. What you feel, what your perception of the pain is, would fluctuate by 1 point based on your surroundings. By the reason you're getting the pain is because of the inflammation that your hand produces to let you know that, dude, your bone is broken. Correct? And what we'll end up thinking if somebody has a long-standing pain is that this fellow has imagined it all. There is nothing in the body that could be contributing to it, but everything is coming from a fragment of their imagination or possibly for attention or possibly to get away from responsibility. We'll find 20 reasons of why we will pin that onto that person.
Because we can't see the fracture.
Because we can't see the fracture when the pain becomes chronic, which is why it is so important to figure out what is the root of pain. And these very same people who are referred to us by psychiatrists, the moment that root is reversed, we see these people writing books. We see them conquering mountains. We see them having very happy lives. And suddenly it's all because the stress went away. Correct?
Highly fulfilled lives, right?
Yeah, very, very.
Just because you've taken this aspect out.
Yeah.
And probably Maggie along with it. Maybe Maggie was one of the reasons.
Biggest
inflammation. Reason. Okay. So Raashi, so now that we've understood an aspect of pain, what can we start doing about it? So one, that we don't get into a situation where we get chronic pains. And later on, if you do have chronic pains, what do we do about it?
So I'm going to first define what is acute pain and chronic pain, just so that everyone's clear on that. Guys, this is not a medical definition. This is me making things simpler for the lay person to be able to understand what's going on. Okay. So what is acute pain? Acute pain is pain that your body produces as a sign of inflammation, where there is an actual injury to the body or there is a probability of an injury. So if you have, for example, touched something very, very hot, or if you have broken your hand, your body will produce the signs of inflammation, which are 5 signs, which are, there would be redness in that area, there would be swelling in that area, there would be a temperature change in that area, there would be pain, and there would be loss of function. We have Latin words to describe them medically. We say rubor, dolor, calor, um, pallor, and functiolacia. See, I remembered. But basically, this is your body's way of letting you know that something has happened, some injury has happened, some virus has attacked. So even say you were going to get fever, you would feel a temperature rise, you would feel red, you would feel pain probably in your throat. There would be redness somewhere. There would be swelling in your tonsils possibly, and you would feel malaise, you would feel fatigued. And the moment even that injury is out of your body, that virus has left your body, all of these symptoms go away. So inflammation is marked by pain. And that kind of pain is acute pain. Injury aaya, pain aaya, injury better hua, the pain has gone away, right? The moment the inflammation subsides, the pain goes away as well. Now, chronic pain exists in the absence of a noxious stimuli, in the absence of injury, in the absence of all the other signs of inflammation. So there is no active inflammation, but your body persists and continues to make this cycle of pain in the absence of an injury. So I'll give you a small example. Imagine you had a tooth that was inflamed because there was a cavity or there is a root canal that needs to be done over there, right? When you go to your dentist, there will be swelling, there will be a redness in the gums, there will be possibly some pus over there, your temperature may go up, and of course there'll be a lot of pain, you won't be able to eat from the side. The moment they do the root canal or look after the cavity, the immediate source of irritant is taken away. Maybe that infected root is removed, and your body heals naturally without you doing anything. So your body, once that root canal is done, basically once that infection is removed, will start healing by itself. Correct. Suppose your tooth is absolutely okay. Now it's fine, beautiful root canal done, no source of infection. But your tooth then continues to produce a pain in the absence of there being any infection. That's when we call it chronic pain. So chronic pain is defined by two things. It's defined by the time a person has suffered. So anything more than 3 weeks would fall into chronic pain, and anything in the absence of inflammation or injury would fall into chronic pain, right? Now, these kind of pains are little tough to look after because your body has the mechanism where it feels pain sometimes in then varying positions. Let me throw an example out at you. Now, if somebody has chronic pain, say in their neck, they may feel it. It may have started out as an injury to one particular muscle in their neck. But when that becomes into a chronic pain, meaning it's been there in their body for many, many weeks, there is a regular maybe activity that's irritating it, but now the muscle has become extremely fatigued. Then what you will land up feeling is the pain not only in your neck, but you may feel it as a deep, dull, achy headache at the top of your head or near your temples or on your cheeks, or some deep, dull pain going into your arms, going into the front of your chest, possibly going into your shoulders, in your upper spine. Now, this kind of pain, if you were to think of it yourself, and for pain, most patients become doctors, right? Because they want to figure it out and popping pills. So everybody feels that they just know what to do about it. But when you're sitting and you're thinking about your body, you'll think that, oh, today my left shoulder hurts. But yesterday my left back of the head was hurting. Day before yesterday, the front of my neck was hurting. And you start second guessing yourself. And you keep thinking, where is this? And you're absolutely right. This is all real because it's referred patterns. So chronic pain tends to have a referral pattern, tends to have an expanse more than what may have been the starting point. But if I were to examine that same patient, I would realize, boss, you have a single tightness in your muscle at this particular point. What you have been doing is you have been icing your entire arm. What you have been doing is you have been trying to look after the entire expanse of the problem. But the source of that problem is that one pin prick that you may have missed.
Correct. Very, very beautifully put. And, like, for example, we don't realize this, but there are so many aspects of our life that we do or take for granted that can lead to such kinds of chronic pain. So, for
Right.
example, I used to work with a physiotherapist, and there were clients who would come who used to carry their wallet in the back pocket. Correct. So now, obviously, there's going to be a difference in their pelvis as they're sitting down because one side is always tilting higher than the other because their wallet's in their back pocket.
Right.
So, of course, there will be lower back pain. But what we don't realize is that there will also be shoulder pain. Because if your body is leaning to one side, you're trying to constantly try and align it back again. So it's
Right.
not just your lower back that's going to hurt because that's the area where your wallet was kept, but it's also up in the shoulder that could possibly start hurting. Correct? For some people, it got so bad when they used to drive a lot because they keep using the accelerator brake, but the left leg doesn't get used at all. So there was an imbalance created there, or the way that they would lean their hand on the car door while they were driving. So it's so interesting to understand that these kinds of actions that are repetitive in nature can lead to things. And one of the habits that I talk about is how do you add different kinds of movement into your life so you don't have this kind of repetition. So one is, of course, get rid of the wallet from your back pocket. But apart from that, when you're sitting at home, don't have a favorite seat. Because when you have a favorite seat, you're sitting on one side of the sofa, so you're always going to be sitting at an angle because one hand is higher than the other. So
Correct.
I know I've taken your topic a little
No,
off the rails here.
I'm glad you brought that up because what we forget again over here is our spine, though we call it reed ki haddi, spine, it is not one bone. It is lots of little bones which are placed one above the other. It supports our head and goes all the way till our buttocks. So any kind of misalignment or any kind of loss of equilibrium at any part of our body, even in the lower limbs, leads to a shifting weight in the upper part of the body because the body is constantly compensating. The body always wants to be in the most balanced comfort position. So that kind of overcompensation absolutely affects the upper cervical or the upper neck as well. A lot of people, since we're talking about habits, there are a lot of people, when we look at them, like if you look at a photograph of, say, 15 girlfriends who went out for a trip, you will see each one of them will have a head tilt in a particular way. But that head tilt that we land up having actually shows us the side that is tighter for us than the other, because our head tends to tilt on the side towards the muscle weakness, the side of the muscle weakness, or wherever we have tighter, more compressed muscles. But also what I wanted to add over here was a lot of people have a tendency or a habit to sit in a forward head posture, meaning their chin leads their face forward. And a lot of times we believe that, oh, this is coming from my posture, or maybe because I'm using a laptop, or maybe because I'm using my cell phone at a particular angle. Absolutely right. These also contribute to a forward head posture. But a lot of times, people who are habituated to mouth breathing, people who have possibly an airway compromise in their nose and are compensating or adapting themselves to mouth breathing, have a tendency to also sit in this forward head posture. So they make this mental habit of constantly sitting with their chin leaning forward, and therefore land up compressing the muscles at the back of the neck constantly, and leading to a lot of headaches and back issues as well. So they may keep thinking that this is coming from my posture, this is coming from my computer use, but it is more likely coming from your body's adaptation to breathing and the habit of sitting in that forward head. So when we look at reversing habits for pain reversal, chronic pain, one of the biggest habits I look out for are this forward head posture reversals that we need to work on. And in order to go with the forward head posture reversals, we have to first figure out, why is this person not breathing well enough from the nose? So whether it is allergies or a deviated septum or a polyp or just some sinusitis, We need to figure out why this person has chosen a particular habit, because even habits are choice, but we don't take on all the habits that the planet has to offer. We pick and choose our habits based on conveniences chosen by our physical body, emotional body, mental body, and our spiritual needs as well. Right?
Yes,
So
absolutely.
our physical
And
body
like, for example, sorry, I cut you off.
Not at all. I was done.
I was saying that, it's so interesting that so many of my clients that come to me have this mouth breathing issue, correct? And they don't realize that they're mouth breathing till you start pointing it out to them. Till you start saying that, do you wake up in the middle of the night, mouth dry? Okay, so that's maybe one symptom. So you start looking at it, and snoring for
They
sure.
snore. A lot of people sleep with their hand tucked under their chin to sort of lift their chin. A lot of people will find that they use their palms folded together like a namaste below their heads, or they tend to squeeze their shoulder below their ear. All ways of supporting your neck while mouth breathing. And you know why people don't realize that they mouth breathe? Is because I can compare my hand to yours, but I can't compare your breathing to mine. Correct? I don't know how you breathe. I only know how I breathe. There's no way of comparing that. I can compare my right thumb to my left thumb. But breathing is something that is individualistic, but it's also something that you may have been born with, but you don't know any better. So if a person was born with, say, a deviated nasal septum, which means basically that the bone in the center of their nose is slightly crooked, then their body breathes very differently than, say, B person who has completely open airway passages. And there is no way for the two to compare it. Also, we are not like our puppies and our dogs, right? When they run around, they very quickly, to cool down, stick their tongues out, mouth open, and they take in air very, very quickly. Now, we do it very gently and very judiciously. So most mouth breathers tend to take in air when they're talking. So very gradually, very sophisticatedly, we'll find ourselves taking those little pockets of air. And you'll also find people taking sighs, those romantic sighs that Rajesh Khanna and you would say, like, so that is actually big breath of oxygen in from my mouth because I can't take it from my nose. You'll also find mouth breathers yawning through the day a lot because body will suddenly want to take big gasps of oxygen to compensate for what they can't get naturally.
Raashi, I feel you've been describing me 5 years ago. Like exactly all these things. I used to sleep with my shoulder underneath my head. I used to gasp. I used to sigh. All these aspects 5 years ago till I started learning to fix myself. And learning about these small things that I could possibly do. Things that were wacky and people thought I was mad doing, but they worked. So, hey.
Yeah, I know you have actually helped yourself so much by increasing your lung capacity and compensating for what your nose may not be able to give you by making your holding chamber more and more strong and powerful. Our body is...
Even with my Parsi nose, Even with the big Parsi nose of mine.
Well, I'm sitting with my big Sindhi pakoda nose in front of you, also with an airway compromise. But having said that, our body is so beautiful, so beautiful. If you get a cut on your finger and just for the heck of it, you decide to just stare at your finger for like 20 minutes without doing anything, in the absence of treatment, your body just sends in the cells, the platelets do their thing, and that entire cut naturally stops bleeding. Because your body needs only that little bit of awareness, needs only that little bit of guidance, needs only to recognize its patterns better. And the moment you're able to do that, it can be life transforming.
Beautiful. Beautiful. So, Raashi, let's talk about a few things that people can start doing from today to help themselves with pain, or something that they can add as habits. Like, we were talking about awareness of your body. What other, top 3 things that can start moving people away from pain to a more painless existence?
Okay. For any type of pain, one of the biggest habits that I want everyone to do is to start talking to your body. Don't think of your body as some separate entity that you have to look after. अरे मेरे सर में ना हमेशा दर्द होता है. Your sir is not a separate part of you. Start talking to your body and asking your body what it needs. You'll be very surprised with the innate intelligence and intuitive ability of your own body to tell you what needs to be done or not. Whether you have acidity, pain, gas, these are symptoms. This is your body giving you discomfort, a dirty smell, to let you know that I'm going to produce all of this because you're clearly not listening to me. So I'll do all of this to grab your attention. Listen to your body. Why is it grabbing your attention? So awareness of your own body, even something as, I know it may sound very hoo-hoo-ha, hocus pocus, but at least telling your body showing your body gratitude and telling your body that I promise I'm going to look after whatever pains you give me. Just show me the direction. Number one. Number two is something that you constantly talk about, which I believe very strongly in as well, that our body in the physical aspect is a machine. If you don't use your machine, even the most expensive machine will not work. Use your machine. Circulation is a very, very big part of healing. And oxygenation is a very, very big part of healing. Things that you do to increase your breathing capacity, whether it is pranayama, whether it's doing an aerobic class, whether it is going out for a walk, whether it's running with your child, whatever, do some form of movement to increase your oxygenation and also to make sure that your body is getting that kind of mobility that will integrate and allow for circulation to happen to different aspects of your body. That's very, very important. And the third thing is, so we have spoken about you as an overall. We have spoken about individually as a physical movement body. Third thing is, I'm going to throw in a couple of things from every aspect. So I spoke about how you look at your body as a whole, that is talking to your body. I've spoken about the physical aspect of it, which is move your body, oxygenate your body, see what nut and bolt is loose and what you need to figure out from a injury point of view. The third is the emotional aspect of our body. So emotionally, a habit would be great is recognize your patterns. Do I tend to deaden out my pain when it comes? Am I looking for quick fixes? Am I looking for a fatafat solution to subdue my pain? Or am I going into victim mode? Oh, me, poor thing. Or am I doing it for... do I like being in pain because it allows my husband and my son to give me more attention? Figure out what aspect of your emotional body gets fed. And a very silly way of doing it is ask yourself, how does this pain benefit me? Okay. It is life transforming if you ask yourself, because there are lots of people who tell me, I have bad knees, so I can't run. So you actually get benefited. You are enjoying your laziness by not allowing yourself to get better because your knees are a good crutch for you not to get 100% okay. Okay. So this is your emotional aspect. Mental aspect, very buddhi. You have an intelligence. Go looking for the right answers. If you have, keep a diary. I get pain every Monday, Tuesday, Wednesday. What am I doing on Sunday? Oh, Sunday I'm going drinking with my friends. My potassium
34 tequila shots.
Yeah, my potassium is depleted. Please understand your body from an intelligence point of view also. Your pain could be coming from maybe a thyroid issue. Your pain could be coming from maybe a genetic autoimmune condition. Your migraines could be coming from a hormonal source. Have the intelligence to seek the right answers. And spiritually, so we spoke about overall, physical, emotional, your intelligence or your mental aspect, and spiritually, your body is a cesspool of energy. Where energy will get blocked, will produce some amount of changes. Now, there is a lot of talk medically to include this, where Ashdin and me had a conversation on this as well, where they talk about lymph flow, where the Chinese talk about meridians, where Ayurveda talks about kosha and prana movement. So energy is what keeps you alive. Recognize what you are blocking. So if sitting in a particular position is blocking the flow of energy for you, recognize that. If you feel at that time that by meditating for maybe few minutes in a day, you are allowing yourself to align your body, center yourself, do that as well. But recognize where the flow is getting dammed, because wherever it is getting dammed is what you need to work primarily on.
Yes.
Was that too?
No.
I tend to go very spiritual jargon as well. So
not at all, not at all. And it's so interesting. The first one starts by listening, correct? Communication. Having that conversation with your body. And I loved what you said about showing the gratitude of the body, saying, Baba, lots of gratitude. Tell me, how can I help? Tell me, where's the pain? So learning to talk to your body makes such a huge difference, especially when it comes to pain. Because I know, like, and I'm merging most of your 5 ones that you've broken up right now, is that very rarely do I get a headache nowadays. And if I do, I can start pinpointing why. Oh, I didn't have enough water today. How strange. Let me have some water. Oh, I was just sitting in one place looking at the screen all day. Okay, maybe this could be because of that. Maybe it could be because of this. And you start that process of saying, how is this happening to me? Instead of saying, how can I get rid of this pain? Correct? And I'm sure it's that example of if there's a fire in your house, you don't take out the fire alarm ka battery. Correct? You try putting off the fire and try figuring that aspect out in your body. And what I loved about what you said in the end, which was the emotional part, how is this pain serving me? Oh, I think that's a clap moment in itself, because if you realize that very often pain serves you. I'll give you a very sensitive example from my life. I used to be in a very abusive relationship, and every time I used to feel traumatized or hurt or some aspect of it, or angry, I used to try and hurt myself so that I got sympathy for that pain. I remember trying and getting my hand stuck in a door, or try hitting the door and hurting my hand. So it's interesting now that you're talking about this, where that possible thought came from, saying that, why was I doing that? Why was I trying to get pain just so that I could get sympathy? And it's this question of being honest to ourselves. I'm not saying everybody is doing this, but I'm saying that if you are doing this, at least catch yourself doing this, because that is one way of understanding pain. And finally, the last part, where you merge spirituality with our meridians, with our lymph systems, etc. We are understanding this aspect, and you're saying that energy flows stop. It's so interesting to understand that our body innately knows, right? When you're stressed, or when something's not going your way, or when you're fearful, you hunch over. Correct?
Yes.
You're blocking the flow, in inverted commas.
Your body.
Correct. You compress yourself. You're blocking the flow of energy towards your heart, towards your chest. That's where you'll start feeling it. Correct. And the body innately knows these things, and it's so interesting that we're talking about this. And I remember reading something. I think a few months ago, 6 months ago, when I was reading about these Chinese meridians. And they finally identified this using science, the meridians. They basically put a small dye in one of the meridian points, and they tracked as it flowed through the body. It was crazy. And I'm saying that, like, the Chinese figured this out, and we're catching up on this. So most of it is not
Ayurveda has it as well. Ayurveda has it as well. All our innate medicine worked on being able to look after all aspects of your body, right? I am a Western medicine practitioner, guys, but it's only when I was in the US and I trained in New York for several years. It's only when I came back to India and I was questioning, why did I come back to India? I was so happy in the US. I was minting tons of money. Why am I back? And what did I need to do by coming back? And I recognized that there is this treasure trove of knowledge that is available if we are willing to look and seamlessly integrate it into our body for allowing ourselves to live healthier, happier lives.
Correct.
Overall. Like, we need to be awesome 180 throughout, not just physically.
Absolutely.
I'm emotionally so good, but I weigh 250 kgs and I can't move and get myself a plate of food. Or I fear food. Whatever.
Raashi, if you're free in December, please come. We're in the process of creating a fantastic retreat in an Ayurvedic center in Kerala. So we had a doctor on the podcast called Dr. Vignesh, and he has this center in Kerala called Sitaram Retreat, and we're doing it there in December. So we're still planning it out. It's not finalized yet.
December.
Please come. This December. Everyone's stuck at home. Might as well come. Then, so we're figuring all that out because I know people need it right now. Can you imagine, like, everyone is stuck at home plus the stress amount that's building up? I think this is a good break. So if we can keep everything, properly aligned, I think it'll make a lot of sense.
Yeah, let's work on it. Would love to.
Come. It'll be fun. Okay. So Raashi, we have another podcast that we're going to be doing on Thursday. We're going to focus on our migraines and our headaches in that one. This podcast is all about pain and understanding the language of pain, understanding a few of these habits that you mentioned. I love those 5 habits on understanding your pain and understanding your body. Absolutely brilliant. Okay. Thank you so much for coming and talking to us and everybody about pain, because I know this is something that is troubling so many people. I used to live with chronic back pain for God knows how long, and I know exactly what people feel like. So thank you so much. How can people reach out to you? How can people connect with you if they want to come and either consult with you or ask questions?
So I'm available at PD Hinduja Hospital, Mahim, and I'm also available at Mind Temple, Juhu. And because of the pandemic, we are also offering online consultations. Y'all are welcome to DM me on Instagram on Doc Raash, and also you can write me an email on info@ofpindia.com. And I'm very, very happy to help you all and looking forward to help you lead a very wholesome, pain-free life. Thank you for having me, Ashdin.
Yay! Superb. Thank you so much, Raashi.
If you like this podcast, don't forget to check out other interesting podcasts on the IVM network. You can listen to us on the IVM Podcast app or ivmpodcast.com. You can also follow us on social media. We are at IVM Podcasts on Twitter and Instagram. If you want to reach out to me, I am Ashdin Doc on Twitter and Instagram. You can find lots more information on my website, awesome180.com, or check out different content on my YouTube channel called AWESOME180. That's Awesome180.
I hope you enjoyed that show. If you aren't following us on social media, please do. We're IVM Podcasts on Twitter, Facebook, and Instagram. I want to let you all know about 2 new shows that we've launched this week. The first one is Millennial Athletes, hosted by Tanvi and Shlok. Both of them are, they spent their life playing badminton, and they know a lot of athletes, and they want to talk about the particular challenges that athletes face. Really, really great conversations. Do definitely check that out. The other show that I wanted to mention to you that we launched this week is Naan Curry. Naan Curry is a show it's about food and the history of food and the economics around food and its consumption and all that kind of stuff. It's a really, really interesting conversation. It's hosted by Sadaf, Zenatha Chef and former MasterChef India finalist, and Archit, who is a researcher who writes on behavioral science and economics. Definitely worth checking out. Besides that, we had a great week as always, right? Great stuff on all the normal shows. Do check those out. But with that, hope to see you again next week.
Beta, did you know 79% of all scientists in NASA are Indian only?
देखो, इंडिया में टैक्स सिर्फ मिडिल क्लास भरती है. Everyone is just enjoying free यार.
आजकल के youngsters are only interested in partying and enjoying. उनको देश की पड़ी ही नहीं है.
बेटा तुम बस शादी कर लो, उसके बाद तो you can enjoy life like anything.
I will tell you what this country needs. This country needs 15 years of dictatorship. That is the only way to become a superpower. See the Chinese, how much they've progressed.
सुनो, तुमने ये WhatsApp forward देखा?
So what's common between all of these statements?
They're all absolutely rubbish.
Fake WhatsApp forwards that spread like wildfire.
And statements that defy any logic.
We are here to debunk them all.
Way of family WhatsApp groups, worst nightmare. Where what happens when you read a book.
Basically, we are just a bunch of guys who want to cut through the bullshit of everyone saying this, how it won't be true.
So that the next time someone confidently squeezes out some WhatsApp or Twitter BS, you can look them dead in the eye and go, Uncle, please sit.
So join me, Joel.
And me, Tushar.
Every Mondays for a fresh new episode of Uncle, Please Sit.